Well, good morning. Welcome back to the Broadcast Retirement Network. I'm Jeff Snyder. This is BRN AM for Thursday, July 20th, 2023. And our top story, brain connectivity and memory improves in older adults after walking. Joining me now to discuss this and a lot more is Dr. J. Carson Smith of the University of Maryland School of Public Health. Dr. Smith, it's great to see you. Thanks so much for joining us on the program this morning.
Thank you very much. It's really a pleasure to be here.
It's a pleasure to see you. And you know, we talk a lot in our society about the importance of exercising, the importance of walking, how it's great for the cardiovascular system. But you and the team at the University of Maryland at College Park, you've done a lot of research on how walking can actually help with your cognitive abilities.
Yeah, that's right. We are very interested in this dynamic, this mind-body connection where, exercise not only impacts the peripheral health of your body and your heart and blood vessels, but, we believe that, whatever happens also peripherally, whatever happens, outside the brain also impacts what's going on inside the brain. And likewise, what's going on in the brain is going to impact the health of your external systems as well.
And in particular to your study, you actually looked at maybe older Americans, older adults. There's a significant impact. So you go out and take a walk, and I think in your study, you actually had people walking on a treadmill, but I guess the same could be said for going out and taking a general walk. This is really a positive when it comes to maybe staving off or delaying some of the cognitive decline that we hear so much about amongst our older population.
Yeah, that's right, Jeff. So, walking exercise is one of the most common, obviously cost-effective, means to get exercise. And it's something that, most people have access to someplace to walk and hopefully someplace safe to walk. So we decided to focus on walking exercise because it's the way that most Americans could satisfy, their physical activity requirements without having to go get a membership somewhere or enroll in some specialized program or pay a personal trainer or something like that. So we focused on walking exercise, although, in our study, it was supervised walking exercise, which, is important because not everyone, can maintain a regular exercise program without some encouragement and some social support as well.
Yeah, and I, for one, am someone who falls into that category. I try to be self-motivated, but it is sometimes very difficult. In order to see an improvement or to stave off the cognitive decline, Alzheimer's, dementia, approximately how long would I need to walk? Or what do you find from the study? Is it a 30-minute walk? Is it a 20-minute walk? I know that the commonly they say it's 10,000 steps. So I don't know if that equates to a time frame or if that even relates.
Yeah, so the 10,000 step recommendation is a very general recommendation that, you want to accumulate over the course of a day, and that could come from doing your grocery shopping to going to check your mail, to some purposeful, exercise. But, in our case, we use 30 minutes of exercise on a treadmill. There are a lot of different ideas regarding, how much, and that's really an unanswered question, regarding the dose, that's necessary. We do know that in our case, the exercise, 30 minutes in duration, 4 days a week, is enough to improve your fitness when you're, starting off being unfit. If you're a sedentary person and you start exercising 4 days a week, 30 minutes, you are going to improve your fitness. And so that it was enough in our case to show changes in cognitive function and some changes in brain networks as well, that we believe have implications for, staving off dementia and cognitive problems.
Well, Dr. Smith, I need to take a very quick break. When we come back, we'll talk more about the study and its impact, how you can improve your cognitive abilities and stave off dementia. You're going to want to stay tuned right here on BRN AM. Imagine a new television network that will make you richer, healthier, and in control of your financial future. This network is for the policewoman in Nashville, Tennessee, the baker in Dubuque, Iowa, the teacher in Lexington, Kentucky. We want to make the idea of savings and retirement culturally relevant. But what do you see as a defining issue of the midterms? Especially for the smaller businesses. I mean, they are the lifeblood of the American economy. Featuring exclusive interviews, current affairs, and docuseries. 33 years old, you retired early.
The philosophy is money only matters if it helps you live a life that you love.
But you got to start thinking about retirement as soon as you get in.
The Broadcast Retirement Network will drive very high engagement with premium partnerships. So this isn't retirement and savings for your parents or grandparents. This is for all Americans. And we're going to change the way you think about money. Welcome to the next frontier of retirement and savings. This is BRN, the Broadcast Retirement Network.
Are you stuck with a low credit score? A credit report and score that's causing you to be denied credit or pay higher interest rates than others for the same things? Then do what Terrence did and call Credit Repaired for your free credit evaluation to help restore your credit.
I started thinking about buying a new house, and my score wasn't where I needed it to be. I called and spoke with one of the representatives, and we just had a good conversation, and I liked what he was saying.
Just one call for his free credit evaluation was all it took to start back on the track to repairing his credit.
I'm seeing the deletions and I'm getting the report, so I know something's being done. It does make a difference to me.
All it takes is one call to get started.
Credit Repair has given me a second chance to have a better credit score.
Don't let a low credit score hold you back another day. Do what Terrence did and make the call for your free credit evaluation.
Call 800-819-4152. That's 800-819-4152. Again, 800-819-4152.
Welcome back. We're joined this morning by Dr. J. Carson Smith of the University of Maryland School of Public Health. Dr. Smith, thanks so much for staying with us. Really appreciate you hanging around for segment number 2 this morning.
Yeah, this has been a lot of fun. Let's keep going.
Yeah, and by the way, during the break, I took a 30-minute walk around the apartment. I'm just kidding. Let's talk about let's delve a little bit deeper into the study, and I want to talk about you did some MRI evaluations of the subjects. Tell us a little about what the MRI results look like and what do they mean?
Sure. So we use many different types of measurements to try to understand how the exercise is affecting cognition. We use paper pencil testing. In fact, one of the major aspects of memory that's lost is episodic memory, which is your memory for episodes, things that have happened to you in the past, what you ate for breakfast or, somewhere you went in the past several months, those kinds of things. And so we use stories. We have a brief story we tell people and then have them remember as much as possible of that story to test their episodic memory. Well, that memory tends to decline as people get older and also is a sign of early memory loss. So we're interested in that, but more than just the paper pencil testing, we use magnetic resonance imaging because, we want to know what exercise is doing in brain networks that are controlling our memories and our ability to remember things and bring it back into consciousness. So we use magnetic resonance imaging to look at the blood flow patterns in the brain. And those blood flow patterns help us determine what parts of the brain are actually communicating with one another. It's not just one part of the brain that controls all of our memories. We have brain networks that form these complex communication hubs that need to crosstalk and communicate. You can think about it, as a very complex wiring diagram you have in your brain. And so we looked at these communication patterns, and we found that there were improvements in these communication patterns in some of the brain networks that were related to the improvements that we saw in their ability to remember, these story details. So just 12 weeks of walking on a treadmill, improving your fitness over the 12 weeks, improved the brain network function and also the actual memory performance that we observed.
Yeah, and in terms of it sounds like the recommended. I don't want to put words in your mouth, but in terms of the recommended walk, and again, you're not walking miles and miles and miles. It's really just 30 minutes, but could 4 days a week really have a positive impact on ongoing and future cognitive function?
Absolutely. We don't know with conclusive evidence that it's going to prevent dementia from happening to people. Dementia is a very complex issue, and there may be things that you can't do to stop some types of dementia from happening, but we do know that it's never too late to start exercising. The individuals in our study were in their late 70s. They had not been exercising regularly, and the exercise that we had them do improved their function. Not only that, we had a group of individuals who were also already diagnosed with early memory loss. So they had mild cognitive impairment. And even those individuals who you might think, well, there's not anything you can really do to help them. They're already kind of on this slippery slope. But even those individuals showed improvements and showed the same brain network changes. Now, they still were cognitively impaired at the end of the study, so we didn't cure them, by any means. But we did show that, the brain is still plastic, even in old age, even in people who already have some kind of memory loss.
Yeah. And how do you follow up on this research? What's the next step? Because, obviously you've looked at walking, you've tested these subjects. Well, how do you build upon that? What's the next step for the research?
Yeah, so ultimately, we would love to be able to show that exercise, does prevent further decline. We don't have the funding or the ability to, over the long term, to really follow everyone as far as we need to. But we are interested in looking earlier in the disease process. So we're really focused on people now who have a genetic or family history of Alzheimer's disease. And we want to understand if you are cognitively healthy still, but you have this family history or a genetic risk, and you are physically active, can you modify your trajectory? Can you change brain function, or can your brain networks be improved such that you might be protected, as you get a little older? So that's one thing we're doing. And we're interested in what single sessions of exercise do to people's brains. We view exercise as a medicine. And so if exercise is a medicine, and we're going to compete with the pharma industry in, treating and preventing dementia, we need to show that a dose of exercise is impacting physiologically, the brain in a meaningful way.
Yeah, absolutely. Well, this is such a horrific disease, and it not only impacts the individual who's inflicted, but it also impacts all the family members and their caregivers. Dr. Smith, great research. Thanks so much for joining us, and we look forward to having you back on the program again very soon.
No, be happy to do it. Thank you very much.
And that wraps up this episode of BRN AM. Have a topic of interest, someone you think we should talk to, drop us a line. And don't forget, for all the latest curated news and lifestyle, wellness, finance, tech, so much more, all in one place, check out today's edition of our daily newsletter, The Morning Pulse. Want to search our archives, check out our latest content, then visit our website, and of course, all of our streaming partners. We're back again tomorrow for another edition of BRN AM. You're not going to want to miss it. Until then, I'm Jeff Snyder. Stay safe, keep on saving, and don't forget, roll with the changes. Now is your opportunity to co-create content around any topic on the first lifestyle and wellness network. Reach a global audience through our platform and co-own exclusive branded content. All of our programs are available on demand and also as audio-only podcasts, so you can take us on the go. Broadcast Retirement Network, available anytime, anywhere, and on any device.
Tax audits, tax liens, wage garnishments.
Every day we hear stories like this about good folks who are simply struggling to pay their bills. Each of them are living a frightening IRS tax nightmare, and they are afraid it will destroy their lives.
I'm a divorced single mom, and my ex-husband left me and the kids with a lot of unpaid bills, including unpaid taxes. I was really starting to show my stress on my kids because the IRS had sent me a letter demanding a huge payment from me. I couldn't afford it. So then the IRS was threatening to garnish my wages. I'm already living paycheck to paycheck. That would have put me over the edge financially.
It truly seemed hopeless, but then a friend at work told her to call the tax relief line.
The people at the tax relief line, they told me about something called innocent spouse relief. They worked it out so that all of the taxes from my ex are not my problem. I don't know how that works, and I don't care. All I care about is that I don't owe the IRS a dime, and they are not going to take my paycheck.
Even if it seems hopeless, you should call the number on your screen right now. There is absolutely no cost for the call or the consultation. You are under no obligation. If you are worried that the IRS could garnish your wages, seize your assets, even take your home, call us right now. The Tax Relief Line is here to help you. Now you have a knowledgeable, professional team of tax experts that are ready to negotiate with the IRS and fight for you to save you money. The Tax Relief Line's professionals have successfully negotiated thousands of cases, reducing and sometimes even eliminating the tax debt for their clients. It's very easy to get started. Simply call the number on your screen right now. You don't have to live in fear anymore. The call and the consultation are free.